A fourth option, which is often not thought of as a high value service, but I want you to start thinking about it, would be oral conscious sedation. Oral conscious sedation. I'm not talking about IV sedation here, although IV sedation is a great service. I'm talking about oral conscious sedation. You're using a benzodiazepine, typically that's administered before their appointment, and it just makes the appointment very comfortable for them. The benzodiazepine, you should get training on this. Anytime we involve the airway, it should involve training. I really like the work that the DOCS organization does, DOCS, Dental Organization for Conscious Sedation. Brilliant training on conscious sedation. And you don't have to get exotic about it. You can literally do level 1 anxiolysis, where it will be just single dose, no cocktailing. You're not adding other other sources. You're just using the benzodiazepine. You're not multi-dosing. The patient's conscious, as oral conscious sedation would indicate, they're conscious. They fully respond. Turn left, turn right, open wider for me. They fully respond. They're just kind of in a twilight state. And it really allows every visit to be completely comfortable. So oral conscious sedation can be a really good addition to the practice. Naren, I have a client in my coaching work that we recently took a look at this, and we discovered that in this practice, the average oral conscious sedation case was $7,400. $7,400.
Wow. $7,400. That's the average.
$7,400 in this particular practice. And it was not exotic dentistry. It was fillings, root canals, and crowns. In this particular office, they have CAD/CAM. They have in-office milling. So they're actually doing all that in one visit. It's a longer appointment. Depends how much treatment they need, but that $7,400 case is typically a 3 or 4 hour appointment. But the patient's completely comfortable. That's pretty good production per hour, wouldn't you say, Naren? When you look at that,
that is excellent, Gary. I mean, that's one of the reasons that I noticed, that one of the benefits I notice our clients enjoy is that these high value services would significantly increase the production per hour. So almost like you have like one arm that is 3 times, 4 times more powerful than the other arm. So I'm using arm as like a metaphor for hours, right? Some hours are so much better for you.
One of the great advantages in our own practice, we choose not to charge for oral conscious sedation. We don't charge for it. When you go through the DOCS program, they'll tell you that, about half of their participants charge for it, about half of them don't. We've chosen not to charge. A typical charge might be somewhere between $350 and $400 for the oral conscious sedation. And by the way, there's a legitimate, rationale for charging because you had to go through training. You need to have some armamentarium. You need to have the ability to monitor vital signs. You need to have reversal agents, locked in a cabinet. So there is training and there is justification for that. But we tell our patients that when they ask, well, does the sedation cost more? We say, well, we've chosen not to charge for that. We don't charge at all because we simply want to remove any barriers so you can have as comfortable an appointment as possible. Just so you know, a typical charge for offices that do charge is between $350 to $400. And we let them know that so that way they have some value attached to it. But we choose not to charge so we can make sure that that's not getting in the way of you having a very comfortable appointment. About the only downside, Naren, is that they have to have someone drive them and pick them up because they're not in a position to drive after the appointment. And they just have to, organize a driver for them. And, these days that could be Uber, it could be Lyft. Generally it's a family member, that drives them home. But oral conscious sedation, and doctors, it can be some of the most enjoyable dentistry you do because you could get up 2 times an hour from your oral conscious sedation and go do hygiene checks. And your patient in the oral conscious sedation doesn't even know you left the room because of the twilight nature of the sedation. They don't know you left.
Right.
So I don't think any dentistry is completely stress-free, Naren, when you're treating a human being, but this might be as close as you get to it. All right. Next, a fifth high-value service. Consider, if it's something you enjoy, doing more full mouth restorative dentistry. You think about patients that are older, maybe 60 plus. A lot of times They've had a lot of different dentistry done over the years, a lot of different patchwork things done over the years. And maybe they're at the point in their life where they really want to get their mouth in good shape for the last chapter of their life. People are living a long time. Retirement now, a retirement cycle can be 30 or 40 years. And people want to be healthy. They want to have all their teeth. They want to be able to eat anything they want to eat. And they want to invest in themselves. They spend their kids' inheritance, right, Aaron? Have you ever seen that bumper sticker on the back of a motorhome? I'm spending my kids' inheritance. They do. So if that's something that interests you, go out and develop your skills on complex restorative dentistry. 3 great places to go. I have a bias towards the Pankey Institute because I'm on faculty there, but the Pankey Institute would be a great place to go. To be fair, there's others. Spear Education here in Scottsdale would be a great place to go. The work that Frank Spear and their team does is fantastic. Dr. John Coyce in Seattle, their work is fantastic. Another great place to go, Dawson Center. The late Pete Dawson, the center continues to provide amazing care, amazing education. There's 4 places you go to learn how to do complex dentistry, for sure. And finally, a 6th high-value service to consider. Consider diagnosing and treating obstructive sleep apnea with appliance therapy. The incident of OSA, obstructive sleep apnea, in the population is way larger than we know. It's a huge segment of the population. And many of those people will not use a CPAP machine, will not use it because of the obtrusive hassle nature of the CPAP. It's like, no, I'm not doing that. And even when you visit with them about the risk, do you understand the risk of obstructive sleep? Yes, I understand the risk. I understand it could lead to my death, but I am not going to wear that CPAP machine. I'd rather, I've heard a patient say, I'd rather die than wear the CPAP.
Right.
Really? Well, there are great dental solutions in terms of airway management and appliances that can allow you to perhaps not only do life-changing dentistry, but perhaps life-saving dentistry.